Hey, it's Patty. This is part four of my glial cell presentation and neurological components of connective tissue pathology. Is I am hoping to do this pretty darn quickly because I said a lot of this actually in the third lecture already. So this is really to wrap up some treatment strategies for these conditions. But please understand that in order to actually treat these neurological conditions, you have to know why you have them. And that is the video 1, 2, and 3. So can't skip anything in order to really figure out how to treat this most effectively. So please be sure if you really want a thorough understanding of what's happening in these neurological presentations, then we've got to head over back to 1, 2, and 3, all of them. But thanks for hanging in there if you've done it so far. I know I'm like cross-eyed and tongue-tied at this point. So I'm going to hopefully fly through this, and there's information on these slides. Feel free to pause. I am not going through all of the information. You'll see why as we get to these slides. But as I've said before, I want to keep the science in here because I don't want you to think this is my opinion and that I have one opinion over the other. This is just science that I'll be presenting throughout. So I have left the science in it. Okay. So to summarize our whole glial cell talk that we've had so far, I have read this through, I think, in every presentation that I've had, so I'm going to fly through this and go back and watch 1, 2, and 3. But basically, when you have an altered connective tissue pathology from genetics, or from other factors as well, as we might find out, but if you have an underlying connective tissue issue genetically, we know that this is also going to affect other tissues that we might not have thought of. I know we think of ligaments so often, but it's not. This is a connective tissue problem, which we know now also includes the blood-brain barrier, basement membranes, other neurological tissue. So if we understand that our connective tissue, the blood-brain barrier, may be less effective, and we're surrounded in an environment of more toxins, stressors, you name it, that we could have more things trying to pass through that barrier that's not as effective. So if things end up passing through that barrier because you're at greater risk for it because it's less efficient, more things can get through, becomes an open door party. So instead of having one thing that comes through, the permeability doesn't get restored unless you actively work on it. So again, open door party, we can have multiple things that are piling up and create this neuroinflammatory response because we have things that are crossing over the barrier that's touching tissue that should not be touched by these components. So we have this neuroimmune reaction that occurs that can cause this perineuronal network irritation or excitability or degeneration that can happen around the neuronal tissue, the nerve tissue, or we can also have more of these anatomical changes as well with the neuroimmune response. We can have adhesions and inflammation around neurological tissue, and that might actually be what's presenting. So the perineuronal network issues that cause hyperexcitability might actually be linked to seizure-like activity. Sorry, it is linked to seizure-like activity, but in our population, it could be a reason for it because we have blood-brain barrier issues. It could also be part of the neural degeneration that we see as well. On the other side of the spectrum, we can have impaired conduction that causes neurodegeneration. So we can have things like, compression neuropathies that are more prevalent. We can have small fiber neuropathy and things like that. And then also from an anatomical standpoint, so outside of the excitability of the nerves themselves, we can have structural changes such as adhesions or irritations. And we might be seeing that perhaps because there's such a huge crossover, we might be seeing this structural change of dural integrity that's contributing to CSF leaks, adhesions that occur with Chiari malformation, and the neuroinflammatory response that happens with tethered cord as well. So there's a huge amount of overlap with just understanding the simple neurological inflammatory pathway that could be leading to all of these significant neurological diagnoses. But as we talked about in 3, well, you have to repair the barrier. You have to teach somebody how to maintain the barrier. You have to figure out how to reduce neurological inflammation. So it sounds really simple, but we don't have a whole lot of strategies out there. So in this talk, I'm going to talk more about things that we know that either help the tissue itself or things that we know are going to help more of the astrocyte microglia dysfunction. So that's the specific cells that respond when things break through the barrier. We have astrocytes and microglia that start to help, and then they overhelp and they become pathologic rather than helpful. So things that help control the astrocyte microglia dysfunction. But again, we've got to take that trigger out, right? So we have to take out whatever is irritating the blood-brain barrier out of that bucket analogy that we talked about in the last lecture in the third session. Okay, so when we're talking about glial recovery, this is actually from the last one from part 3. Mild to moderate forms of reactive vasculogliosis can resolve if the trigger is removed. Okay, the trigger has to be removed for neurological inflammation to start to be restored, right, or regulated or maintained. When we have more extreme activation of astrocytes that respond to tissue damage, that might be more of the glial scarring or border formation that we're seeing, so more of this anatomical change, this morphology change that actually I really showed more pictures of in the second one, right? So we can have this thickening, almost this increased density of neurological tissue and a border-like formation that changes the mobility in our neurological tissue. And this could be longer lasting potentially. There's not much on the research and long-term recovery on this. I've said before in part 3 that I think maybe this is what microcurrent is working on in my population that feels freedom of mobility return in their neurological tissue. Perhaps microcurrent can help that. I haven't found anything else that works on this anatomical component of the glial scarring component, but it might be helpful. Overcoming the physical and chemical barriers of the scar becoming possible, so that irritated edge of the scar, that inflamed outline, so that was from 2 and 3. That's really what we're feeling that's irritated. The decrease in mobility happens from the border formation or the scarring, and the irritated outside is what we might have more success with some of these neurological inflammatory changes and working on the inflammation specifically. Axons that have been chronically injured or irritated, we know can actually grow. We have neuroplasticity. We see this with spinal cord injuries, especially chronically injured spinal cords. We know that there's a possibility of improvement, right? So, and for those who don't know, I'm a realist. I'm a skeptic, so I have to try it on myself. I have to hear it from a number of other people. I tell people all the time, I don't offer my opinion, but I will offer scientific facts and hopefully explanations as to why they might work. Sorry guys, I'm trying to chase the sun here and it's just not working today. Okay, let's see. Okay, so glial recovery, the way that we talked about astrocyte and microglia maintenance is similar to gut homeostasis, right? So the environment of the nervous system tissue must also remain balanced. Okay, so all of those different neuroimmune modulators, the astrocytes and the microglia, they all have to remain balanced to be able to function appropriately and keep the tissue healthy. This is referred to as glial homeostasis. Glial homeostasis is extremely, extremely difficult for so many people with and without a connective tissue disorder. I talk about it in all 3 sessions before this, that abnormal glial cell activity is linked with so many of our, unfortunately, more common chronic neurological conditions that we think of as almost normal aging at this point. And it's really not. It's an astrocyte microglial dysfunction. But if we can figure out how to maintain glial homeostasis, we might be able to reduce the risk of these certain disorders like Parkinson's, Alzheimer's, Huntington's, multiple sclerosis, and things like that. Okay, so there should be a therapeutic level of astrocyte and microglia activity rather than overactivity or chronic activity. So this is where, the healthful system turns into pathology. So we don't want pathology, we don't want dis-ease, but it's very hard to receive the right messages. We just have so much going on with our autonomic nervous systems that really helps control this. We might have issues with the barrier system itself, and nobody's taught us how to clean it out and maintain it. That's connective tissue pathologies. So this is really, really difficult. I make it seem really simple. It's really, really not. It's really difficult. Everybody's individual treatment is going to be their own path in figuring out why astrocyte and microglia dysfunction is present, and then how to balance it out and also improve tissue health. But we need to come back to homeostasis to be able to have the best prognosis for somebody. Okay. So astrocytes, just to remember astrocytes and microglia, astrocytes are going to respond to acute or chronic illness. So they're kind of like the threat response system. They respond to brain and spinal cord trauma. Um, with this, and I just put some of the things that I've seen might actually help some of these things. So with brain and spinal cord trauma, manual therapies can be helpful, but this is very specific to somebody that understands neurological inflammation. So those that have a neurology background in rehab, neurofeedback, transcranial magnetic stimulation, TCMS, frequency specific microcurrent. These things can actually be very helpful. I talked a little bit more in the last one about the manual therapy is about brain neurological manipulation of fascial counterstrain. Applied kinesiology is some other things that I've heard about. There's so many things out there. But there's not many people trained, it seems, in the things that are helpful yet. And these are because these are newer strategies. When we're talking about CNS ischemia, so we have reduced blood flow to certain areas of the central nervous system, there are pharmaceutical strategies. There's neurofeedback and the transcranial magnetic stimulation again, and also the microcurrent, just because they can help re-regulate the nervous system with the vascular system. So as in the last one I showed you where the astrocyte end foot attaches to the blood vessel itself, we have to remember that there's a communication between these two. So we can actually influence vascular tone and also the any vascular inflammatory responses and vascular insufficiencies through working on the electrical input from that astrocyte. So that could be working on toxin exposure and making, the inflammatory load reduce, but it can also be retraining the astrocytes to just calm down as well, which would be neurofeedback, the transcranial magnetic stim, and the frequency specific microcurrent is a little bit more direct on reducing the neuronal, or I should say the neurological inflammation that happens at that level. When we're talking about infection, you need the appropriate treatment for the infection, and then others as well. So, whether it's a localized infection that's happening and then what's driving it, the mast cell component, autoimmune pathologies, why is the infection still raging is the big question. I'm not a pharmaceutical person. I will occasionally talk about pharmaceuticals as we'll go through some things, but it's not my field. It's also important to understand that even as I'm listing all these things out, it is not diagnostic and this is not prescriptive. So we definitely want to understand that some of these things might work, some of them might not. Unfortunately, it's like food and your gastrointestinal system. I have no idea what your body wants to absorb. It takes a lot of work, but just know that there's a lot of different options out there. But infections, stereotypically, infections have to be treated usually with pharmaceuticals, sometimes with very, very specific and focused and guided herbal remedies too, more difficult. Inflammation, that's a broad term, right? But you have to identify the inflammation and treat it. You have to. Microbial infection, whether it's appropriate herbal or pharmaceutical treatment, similar to infection in general. Environmental toxins, especially mycotoxins or mold. We know this can be an issue. Environmental toxins include plastics and pesticides and tick-borne pathogens, and you name it. So doing detox strategies, being guided through functional medicine, naturopathic, integrative medicine, Amber Walker, she's just wonderful. I had a talk with her the other day, and she's calling her work foundational medicine, and I just loved that. Very foundational of the why did you get here? Let us work on that. So working on that piece of the environmental toxin component can be very beneficial. Tumor activity, metabolic disorder control, seizure activity, and neurodegeneration. So very stereotypically, those last four are pharmaceutical management, but as we talked about in the other previous talks, seizure activity, neurodegeneration, even tumors and metabolic disorders are all on that feedback loop. So just working on inflammation in general. from the top part might actually reduce the activity of the bottom part of this list here. So it's important to know. Okay, so inflammation. These are the chicken and egg considerations. Um, and I'm not trying to say that we can save everybody by doing detoxes, right? Because I have a number of individuals, a handful, not a great amount, but I have some individuals that come in and it's very obvious that their autoimmune condition needs to be treated first. Western medicine has a role. You need to stabilize the individual before you can start working on some of the long-term management strategies. And I think that's really important to note, right? So some of these chicken or egg considerations, and I say this too because MCAS can be caused by toxic exposure. But if your immune system is unstable, we don't want to do a detox first. We want to stabilize your immune system. So you might need MCAS treatment first, right? Everybody's different, but just to understand that this actually takes sitting down and really hashing out how your system responds, what we'd like to try, if we need to modify, and how you respond to things, right? Dysautonomia treatment can be super helpful. I call it the superficial treatment. If you listen to the part 3, which I hope that you did, talking about dysautonomia and how it's regulated by the brainstem. So there's a lot of superficial treatment that can be very helpful and make some of the brainstem work a little bit easier, possibly. So also to note that dysautonomia treatment that seems frustrating and like it's not going anywhere, that we have to make sure that we're ruling out the other things, right? Addressing emotional trauma is very, very important, and it's not to be underrated because again, we're talking about this is the same neurological system that talks to the autonomic nervous system. So your autonomic nervous system can be feeding into that loop of convincing your astrocytes and microglia that there continues to be a threat to the neurological system. So if your system is constantly in fight or flight, it can continue that feedback loop, that self-perpetuating loop of neurological inflammation. So this is not something to not work on because it is tough for a lot of people. This is something to explore as an option. It's not everybody's component, but it can be a strong component in many cases. Physical trauma, we don't want to necessarily point our finger at all of these other things that's not neurological tissue. You can have an old chronic concussion that people didn't think was a big deal, but you have a dura adhesion that's certainly not helping this neurological inflammation, right? When we're talking about the blood-brain barrier and the neurological tissue, not only does it respond differently to chemical, environmental, all those exposures, viruses that are coming in, it responds differently to injury. Same thing, right? So we have to make sure that we're addressing any physical trauma, minor whiplash injuries, post-concussion syndrome that seems to be lasting for a while. We just want to make sure that we're getting that component in there as well. Again, the environmental exposures and toxins, I think this is so important to understanding why so many people look so affected and there's more people that seem to have it. Our environment is getting worse, our toxins are getting worse, and we don't have good things to help clean out our internal system. And all of these other things that go into this, especially the emotional trauma and stress that we live in, is certainly not helping the scenario. So this is personally why I think that we have more people that look like they have a connective tissue pathology, is that we're just almost proving it that we have the genes because our genes are becoming more exposed or our blood-brain barriers are being more exposed to things. I said before, stabilizing autoimmune conditions, if they're primary, you can have a plethora of different genetics. And I have seen a handful of people that I've said, I do think that you have some connective tissue pathology, maybe hypermobile EDS, but I really need you to go see a rheumatologist for Sjogren's. These symptoms are more in line with Sjogren's. We need to get that part under control, and then we can talk about coming back to this connective tissue component. So there has to be this cooperation between stabilizing systems. And again, chicken or the egg, right? Because if you have your connective tissue being broken down, especially blood-brain barrier, and it's creating this, this space of neurological inflammation that is causing epigenetic expression, that's creating the autoimmune pathology to be more symptomatic, then it could be the toxin exposure or virus, whatever it might be, but we can't help that until we calm down the autoimmune thing first. Again, you have to figure out where in that cycle that just keeps going and going and has all these components like on a merry-go-round, right? Like, well, which horse are we going to hop on first? And it's important to figure out what horses are the best ones to hop on for the ride. And it might be Sjogren's, it might be toxins, it might be an emotional trauma. So it's just different for everybody. And then hormonal regulation. This one I put in there again. This is the chicken or the egg because you can have this neurological disruption caused hormonal dysregulation. Of course you can, because we're talking about the brainstem and autonomic regulation, and that controls all of our autonomic stuff that we shouldn't be thinking about. But if we are inaccessible to those parts because our hormone dysregulation is off the charts, because that's just our presentation, then yes, working on somebody that really knows a, a more comprehensive strategy, we'll put it, to hormonal control, and understands how not just the sex hormones, but your other hormones play into each other so that you can get the most precise regulation of hormones. For some people, that can be very effective, and then you can go back and work on some of these other things. The way I say it to people sometimes is, look at all the things we have to work on now. But again, it's just kind of putting everything on the table and figuring out for you, for your story, what is the best scenario with what you feel intuitively, but also what your body is speaking through symptoms. So again, finding those providers that understand how to put all that together is really important. And I understand it's very, very difficult to find, but maybe they'll watch these different videos so that they can understand where neurological inflammation is from when you have an altered blood-brain barrier. Okay, so local physical injury, and this is why I know I talk about toxins and exposure and neurological inflammation so much, but there is usually some sort of physical component that's irritated the tissue as well in a lot of the people that I see. And here are some of the ones that I have seen in my office. Traumatic brain injury, it doesn't have to be severe. When I talk to people, I say, tell me about any time that you have bumped your head that you just remember from history because it sticks out to you, not because somebody told you you have a concussion. I was never told I had a concussion, and it actually took me a while to realize I actually did have a loss of consciousness. So I did have concussion type symptoms, which I never would have put together until somebody really dug it out of me years later. And I realized, oh my gosh, yep, I did actually black out. So important to understand that it doesn't matter what somebody tells you your response to an event should be. It's what your body decides it's going to respond to the event with. The same with whiplash. So if there's a moment where, I hear this a lot, and then some people don't necessarily know it's part of their timeline, but say to me, the doctor told me the whiplash wasn't that bad, but that's when all my symptoms started. Well, if you had a buildup of neurological inflammation for a while, and then you had a minor whiplash injury, you were fueling the fire all along, and then the whiplash, even minor, it's more gasoline on the flames. So again, doesn't matter what anybody told you the severity was in the whiplash. It can actually lead to more gross appearing neurological issues. Upper cervical instability can feed into this loop, and I think I'll probably have a whole separate section talking about this, about the mast cell component and upper cervical instability, but it has its own feedback loop. It's really a neuroimmune center of the body, that craniocervical junction. So this is an area where, whether it's chronic microtrauma from abnormal spinal cord movement, if it's the inflammation piece that we talk about, like, hey, maybe UCI is secondary, maybe the mast cells and the inflammation is breaking down the tissue, or somebody has upper cervical instability from an injury or from anatomical differences. It's something that we need to look into when we're talking about the neurological component, because it's such an access center for mobility and, like everything we talk about, a potential healing area and a potential pathological area, depending on which side it decides to be on for the day. But we want to teach it to be more towards the helpful side, right? Lumbar instabilities, I do see in individuals. I see a lot of them actually up more towards the diaphragm, so like L1, L2, and then down a little bit lower, L5. and epidural injuries, so puncture issues that happen at the level of the dura can lead to inflammation and scarring and things like that. And then any other trauma to parts of the spine or brain tissue. And this is not necessarily meant to be, I laugh, inflammatory in the sense of like emotionally inflammatory of, oh my gosh, I have all of those things, I must have this. Um, Remember, these are just things that I personally think are very workable if we find the right person. Again, I understand it is very difficult to find the right person, but they are out there. Um, but again, working on the inflammation, working on restoring connective tissue integrity, and then working on the local physical injuries just to understand the combination of the layers that need to be worked through for better remission of symptoms. So I talk about this a little bit more actually in the third part section of these different for the focal scar for the actual anatomical adhesions that are developing that inflammatory reaction that's happening at neurological tissue. There's glial-directed therapy, so low-dose naltrexone specifically works on microglia activity, so the phagocytic or cleanup phase of neurological inflammatory responses. There's not a whole lot out for astrocytes yet, but I do think that there is some coming out. There's backdoor strategy like mestinon that's supposed to indirectly help astrocyte activity. MMP-directed therapies, again, a little bit backdoor, but we're working on reducing the global kind of bucket analogy of the inflammation that's building up, and MMPs are part of that self-perpetuating cycle. So there are people out there. I've had a patient come in that started research on her own and found all of these other people that responded well to doxycycline and started researching astrocytes. And there's other medications that are in clinical trials for MMP-directed therapies as well, but they're not released yet. For the anatomical changes, for adhesions, for arachnoiditis, for all of those things, I find such a benefit in neural manipulation, brain manipulation. So actually, and this is very, very different than massage or digging things out or trigger point release. This is a very different approach. And, I say it in the last one, but there are applied kinesiology, IMT, or integrative manual therapies. I know I'm forgetting some and I apologize. I just don't know everything. So if there are other neurological tissue gentle strategies to restore function, please feel free to write them in the comment section. But make sure that you write, like, hey, these are a different neural manipulation, and then write the strategy that's out there so that people can look into it. Neural manipulation, brain manipulation, you can look for Barral providers, Barrall. Through, I believe it's the IAHP to find a provider. And you would have to make sure that you look to see if somebody is neural manip trained and brain trained. So it's a pain in the tuchus. I know there aren't many out there, but hopefully more will continue to learn. And then fascial counterstrain is along the lines of these as well. You can look up fascial counterstrain providers. You can go to their website and see if anybody has advanced training in the neurological tissue as well. And then, like I said, I don't do it, but applied kinesiology I've seen work wonders on some of my patients with the neurological component, IMT, and again, strategies I am just not thinking of right now that might be helpful for neurological tissue mobility and restoration of homeostasis. So there's newer things coming out. Frequency-specific microcurrent and the PEMF, or the pulse electromagnetic frequency, are also kind of together a little bit. Those are modalities that actually from the cellular level might help reset cellular receptors and actually restore tissue back to homeostasis. And I think this might be what is helping the hardening or the border formation in individuals that I have that have tethered cord syndrome and are coming into remission. However, in my experience, we really can only get there, to be truthful, after removing the trigger, or at least while working on removing the trigger. So the reason for the inflammatory effect, especially if it's coming from environmental toxins, viruses, tick-borne pathogens that are still in the system, we need to calm that down, because the microcurrent isn't necessarily going to be curative in that sense. It's really just a modality to help reset the cells. But if the cells keep pushing the receptors back into the same spot because the threat is still there, it's just going to be short-term treatment. And I have had some individuals with tether cord specifically, neurological inflammations. Well, actually, let's put it this way. I'll give you some of the feedback from my patients. Individuals that I have on microcurrent that have not worked on detox strategies or anything for the triggers tend to have an increase in neural sensitivity and neurological pain. So zingers, radiating pain. However, neurological function seems to improve. So it's interesting, but I don't want to cause one symptom for another if we know that we can detox and get rid of all of them. But I actually have patients that have had improved walking abilities, improved bladder function. But I don't think it's worth it for the pain that's associated until we work on the inflammation a little bit more. And I do have quite a few people that, in my experience, and I've talked to one other provider, that with tick-borne pathogens seem to be even just more reactive to the microcurrent in general. So that treatment really needs to be done first before implementing the microcurrent that might be helpful in the future. So it can still be helpful, but it's about timing. And microcurrent and the PEMF is interesting because it's also diagnostic. So if there's ever an adverse effect to the microcurrent, if somebody knows how to read what protocols and frequencies you are on, you might be able to figure out what is happening pathologically in the body because you know what you're, and stimulating is not the correct word, but you know what your directing frequency is at. So, what I tell people is, well, if we have it on a sinus protocol and you are feeling miserable after, there's probably an underlying sinus infection or something like that. So it gives us feedback because it only works on the tissues in the specific way that it's supposed to work on. So beneficial, but again, I know there's a lot of things that seem like magical treatments out there, and they are not. They're not. If it's a magical treatment, you used it at the right time, right place, and I'm so happy. But it can become magical if we have all of our ducks lined up in a row. Okay. We have to reduce the irritants. So this is not something that I can possibly run through because how you do this is different for every single person. But anything that is causing disruption to the astrocyte microglias, things that are breaking through the blood-brain barrier and the basement membrane, these have to be addressed, right? So these are the things to look into. And I don't want people to feel overwhelmed. I always get excited. Look at all the things we get to work on. But we need to rule out chronic viruses, toxin exposure, tick-borne pathogens, emotional trauma as a component, chronic stress, anatomical influences like all the things I had on the other slide, mast cell responses, autoimmune contributions, and chronic infections as well. So just something to consider when we're talking about restoring the health of neurological tissue. And the reason why I think this is important, I think there's a lot of things that can be helpful, but also I have a lot of people that when they start feeling better, their better becomes good enough. And this is just something to keep in mind. I would like your better to be good, not good enough. So if you want to slow down, if you're feeling better, that's great, and we can slow down on stuff. But I would still say there are still things to look into to get you to that good spot. And hopefully actually getting to that good spot means that you're at a better homeostasis and actually will potentially have a better prognosis and be more into remission and less likely to flare up in the future. So it's exhausting, but not giving up on looking into some of these things that haven't been looked into before can be very beneficial if done correctly. Okay, and these are the things I don't know about improving connective tissue pathology. We don't have a cure for faulty genetics that make different connective tissue, right? But are there some things that could help restore damage that was done on top of the faulty connective tissue? So things that have broken down blood-brain barriers and things like that. Possibly the microcurrent, the PEMF, maybe. Maybe that could help restore a better blood-brain barrier integrity and reduce permeability. Um, red light therapy helps restore from a cellular level, so it helps with cellular health. That could be helpful for some individuals, and I know there's something out there in the research about mast cell degranulation that happens with red light therapy. But most of my patients have abnormal mast cell activity, and they do seem to do okay with it, and you can modify the exposure that you give to an individual. Enzyme therapies, these different, or peptide therapies, BPC 157, TB 500, there's not enough research on it. And I'll tell you, without working on the reason why there's more breakdown in the connective tissue, you're not going to really be adding to long-term benefit. So you're still going to have to work on all of those other things. Why are you inflamed? Why is this breaking down more? But peptides might help recover more efficiently. Possibly, we don't know. Enzymes like beta glucan might also do the same. Vitamin C also helps with collagen production. So that could be helpful for some that don't want to go into, you know, expensive peptide enzyme therapies. Okay, I'm not reading all of these verbatim. This is here for your science so that you have the information. So hopefully we're going to fly through these. And if you want to pause to write things down, please do. But I'm providing this, again, I always like to have more options for people because I have no idea what's going to work for somebody. It's really a conversation. So this is something that if you are a patient, please talk to your provider about if you haven't tried some of these things. Or, as a provider, then these are some things to look into to see, especially because I'm more on the naturopathic side. Have you tried these? Are they working in your patients? So this is cross-reference. The way that this information is brought in is looking for astrocyte and microglia control or neurological inflammation or neuroprotection. So please keep that in mind. It's not like there was an article out there that talked about herbal remedies for, neurological disorders in those with connective tissue pathologies. I wish. There's not yet. So we don't have that link up, but this is just in research regarding the neurological inflammation in general, which should help those with connective tissue pathologies. So tryptophan might be helpful, possibly. Something called fingolimod. So that's newer. It's used in MS specifically. So, and then something called mestinon. So this is something else that they're using for neurodegenerative disorders, and those are pharmaceuticals. So tryptophan is not, but the fingolimod and the mestinon are both pharmaceuticals that are newer that might be helpful possibly to more advanced presentations. Gut health focus. So this is interesting. So there is the production of neuroprotective factors and microglia that is actually regulated by the intestinal flora. So I always say there's a backdoor for everything. If you don't feel like you have the ability to directly touch your neurological system without a reaction, what about your gut? Can we play there? Because metabolites will cross the blood-brain barrier, and that's going to also control in that feedback loop microglial transcription programs, and will rewrite their function and output. So if we give it healthy nutrients, basically, that cross the blood-brain barrier, we're going to have a healthier response. So we can address bacterial gut issues, address fungal issues as well. Working with a provider regarding those supplements. So whether it's probiotics, prokinetics, digestive aids, this is not the space to go through all of that, but just to understand that gut health focus might be a backdoor strategy that seems simple, but can still be very effective. And then working on healthy food choices and talk about nutrition elsewhere. But this is really where we start. We don't necessarily start with eliminating specific foods, but just understanding, again, we have systems that don't have great barrier networks. So we don't have great barriers at our gut lining, at our blood-brain barrier. So let's not put bad things into our bodies. It's as simple as that when it comes down to food as step one. So we really need to work on healthy food choices first, taking out processed food that usually has a lot of stuff in it that we don't want crossing our blood-brain barrier, getting good vitamins and minerals, avoid anything that's personally irritating that you know. And then of course, working with a professional if we need to really come up with a specific plan. Okay, the next few slides are polyphenols and phenols. There's a lot of them actually in the research. I'm not going through each one of these, but I did want to talk about a few of them so that you can see, and please read through these, pause, read through them. This is science. This is just so that individuals understand, yes, I'm an herbalist. That's why there's herbal information on here. But just so people understand why I like being an herbalist is because I do find that for long-term strategies, herbalism can help maintain more long-term. It tends to be safer for some, depending on what it is, to take long term for management compared to pharmaceuticals that are out there. And so that, again, we have understanding. Most pharmaceuticals come from herbs. For those that didn't know, it's that they extract isolates because this herb was doing lowering the blood pressure of somebody. So they wanted to know what it was. So they started extracting isolates until they figured out what exact thing in that herb was doing it. And that's where we get pharmaceuticals from in almost all cases of pharmaceuticals. Problem with herbs for a lot of people is that there's a crossover of a lot of things, but they remove the one thing. So that's why you always want to work with somebody who is aware of the interactions of different systems with that herb, so that we can make sure that it's not going to cause a negative reaction in some other thing that you're trying to balance, if that makes sense. So, but just to understand, herbs actually can be very effective for individuals. There is quite a lot of research. We just took a pause in this for a long time when we started making more pharmaceuticals, and now we're starting to come back to revisiting the benefits of them. So gastrodon, again, feel free to read through this at your own leisure, but it actually reduces blood-brain barrier permeability. So does this help restore connective tissue, neurological connective tissue? I don't know, but the research says that it will reduce permeability, which would be really nice to not have things go through there, right? And then it can also help reduce overactivity of microglial cells specifically, which can be helpful, almost like stabilizing with low dose naltrexone, right? Resveratrol, I do not mean to go drink wine. I'm sorry, I will have my own presentation separately from this on neurological inflammation and alcohol. Resveratrol separately from wine um, can be very helpful. Okay, so the actual supplement, it can reduce glial cell activation, prevents delayed neuronal death that can happen, so that neurodegenerative reaction, decreases the level of pro-neuroinflammatory factors in cerebral spinal fluid, and improves cognitive function. Okay, it can reduce glial cell activation, those pro-inflammatory cytokine levels as well, and also their receptors. So if people recognize these names, what those little Latin symbols are, is interleukin 1 beta, TNF alpha, interleukin 6. So those are all just different cytokines that we might have heard before that might be more difficult to find treatments for. Well, we're working on the neurological inflammation might be more of a direct method. Okay. Um, Again, these are other ones. I'm not going to go through all of them specifically, but they all I tried to pick out from the research. Specifically, why am I putting these on here? And it's typically for regulation of astrocyte microglias. And this is, as I go through this is not to say y'all should be taking all of these things and your provider should have you on all of this. Figuring out the appropriate treatment strategy can actually feel super overwhelming when there are so many options. I understand that, but we also have to understand that everybody's body responds differently. So having more options is actually beneficial in the long run for a larger group of people. So we understand here's what we're trying to do with polyphenols and phenols. If your body doesn't like that, how about trying indole 3? Possibly. So again, this is why it's important to work with a naturopath, integrative medicine, functional medicine practitioner, foundational medicine practitioner that understands how to guide you through this process and might have better suggestions based on your complaints. Okay. Again, more polyphenols and phenols. Propofol, I think, is one that some people do hear about out there. So just more on the list here. Okay. There are anthraquinones. So this is imodin. All right. So specifically, this just works on inhibiting microglia activation um, and reduces basically inflammatory mediators being released. Okay, so just another one, just another group. There's actually a lot of different treatment strategies, terpenes and alkaloids. So interesting, I was looking for somebody to look specifically for something that works on astrocyte. astrocyte activity. And a lot of the stuff you can see works on microglia. Again, not a whole lot for astrocytes because I know we just have to stop the trigger itself and then the astrocytes will calm down. But also it'd be nice if we had something, right? So the astragaloside so that the astragali IV for that one there is actually something that does actually help balance astrocyte activity. I do not have enough feedback from people that have tried it, which is something that I was looking at through my research. Okay. Terpenes, more terpenes and alkaloids. From this list, I think that maybe some people have heard of berberine. So berberine actually is supposed to be great for a number of things, right? And what I typically use it for with individuals, or individuals have used it before in talking about their treatment with me, is actually for controlling gut microbiome. So abnormal bacteria growth with oregano and berberine, or just berberine, as a treatment strategy. So this also works on microglia activation as well. So just interesting, like a crossover there, that if you are dealing with gut microbiome issues, especially small intestinal bacterial overgrowth and neurological inflammation, perhaps berberine would be helpful. Don't know. That's something that you'll have to talk about with your medical provider. Right. Flavonoids, there's a lot of different flavonoids out there, a list of quite a few of them here. Different flavonoids as well from this list, I will bring up quercetin. So quercetin actually is a flavonoid that protects the hippocampus. So that's really nice. And it basically helps with reduced neuronal inflammation through controlling oxidative stress, right? So it's like a backdoor treatment, but it's something to consider too. Again, if I would say less is more. So if you're already on quercetin, great, maybe consider something in one of the other categories as an adjunct treatment, or just going straight for some of the manual therapies or microcurrent, whatever it might be. But quercetin can also be helpful backdoor approach to reducing the neurological inflammation. Glycosides, there's quite a few glycosides that are out there. Forcithin is something that I've had individuals use. Don't know of its efficacy. I haven't had a whole lot of feedback on that, but that is something that I've seen just a little bit more research pop up on. Okay, cannabidiol. So I know that CBD is it's less of a hot topic, I feel like now, right? Less of a hot topic, but it's a mast cell stabilizer. And I think that's why it's more of a hot topic for us, because some people do use it for mast cell stabilization. Also to know, it helps just in protective mechanisms of the hippocampus, cognition, memory, glial responses. So it helps regulate homeostasis. And these aren't all curative, right? Because we still have to work on the reason why it's reactive. And then white matter damage, okay, in the neurological tissue. It also has anti-inflammatory, neuroprotective microglial interactions. So just to give a little bit more support for CBD. Scutellarian, so this is a barbed skullcap. And this can actually, it's one of my preferred ones for people who have viruses, chronic viral loads as well, although we do want to be specific. So we want to make sure that it is addressing the virus load that an individual has. But it can help reduce the oxidative stress that is caused by microglia activity that's abnormal. And it's going to inhibit the microglia-mediated inflammatory response. It will help with nerve growth factors. So it helps reverse the activity that's happening with this astrocyte and microglia dysfunction. Curcumin. I'm going to read the bottom first. Curcumin is a wonder herb for a lot of people. However, it can interact with a variety of medications. So we want to make sure that we're cross-referencing, talking to a professional before we start taking curcumin, because it does have a lot of cross interactions. It can basically make something more bioavailable. And you don't necessarily want to do that if your body is more reactive to things, or if there's really a reason why they're keeping you at a certain dosage, right? But curcumin, and this is just neurological system, it does so many other things throughout the body, but it actually inhibits microglia transformation, inflammatory mediators, and then neurodegenerative diseases, so it's neuroprotective. Okay. And then kava. I could talk all day about kava. It's just something that I've researched recently. So since I can do that, I've just put 2 dots on this for you because I know I've talked enough already. But kava can actually have positive effects on both astrocytes and microglia. Interestingly, it also shows neuroprotective properties for Alzheimer's disease, any cerebral ischemia, so blood oxygen issues inside the cranium, convulsion or seizure-like activity, anxiety, OCD, panic, and phobic disorders as well. That's all been in the research. The reason why I have done more research on kava is looking for that alternative for the autonomic nervous system for that chronic habitual alcohol use. And you cannot use both at the same time. You cannot have kava and alcohol around the same time. You can't do it. They both tax the liver. But kava is neuroprotective and actually might help save neurological tissue rather than cause neurotoxicity, which is like the beautiful opposite of potentially the effects of binge alcohol drinking or chronic habitual alcohol use for some people. So kava can be an option to really settle the neurological system and help reduce anxiety and still protect the nervous system too. But again, this is something that you need to talk about with a medical provider. Okay. So to summarize, the triggered, I know I talked about a lot of different herbs and things like that, but the trigger has to be removed for the best outcomes, right? So the trigger is not the tissue. The trigger is not the blood-brain barrier. The trigger is not, um, the irritated neuronal network. So not, it's not that. The trigger is whatever is going into that bucket. So you have to, for the best long-term strategies, you have to figure out what's going into your bucket and you have to remove it. Someone might have multiple triggers and all should be addressed for best long-term management strategies. But remember, I said, if your good feels better and good enough, I'm so happy for you, but I really hope that you continue to work towards just feeling good, not good enough. And that's where continuing to work through what you know is in that bucket or what you don't know and you need to explore with an individual can lead for even better prognosis eventually. Herbal remedies could be helpful to manage or pre-treat neurological inflammatory reactions, right? So they can be very helpful if whether it's something that's already happened or in the future as well. So neuroprotective um, in injuries that can happen. So could we be helping the neurological system now to prevent exacerbating issues with post-concussion syndrome from head trauma? We don't know. We don't have research yet, but it's possible. So it can help be a long-term management strategy for people. It is all still in its infancy. Remember, astrocytes and microglia is really new terminology to the medical world. So it's going to take decades to understand treatment strategies and then decades after that to have this become common medical knowledge, right? So we're going to have to consult with specialty providers. And I know that everybody is going to say, well, there are none out there. And I agree, and I am sorry. And I just hope that the information is out there, though. So these 4 different lecture series, send this to people, send it to providers, or have them just look up the information, send them some of the reference articles, send them a copy of the reference slides so that they can look up some of this information. It is out there in the science, but this is where we're going to get the best long-term treatment strategies is by understanding why the tissue ended up becoming dysregulated. Again, it doesn't drop on you from outer space. It just doesn't randomly appear one day because you look like a great target. It happens for a reason, even with an underlying connective tissue pathology. Okay. All right, and references. So thanks for hanging in there for all of this. I know this was a lot over 4, and I know I talk a lot, but hopefully you can see the simplicity and the complexity in this and start to understand, at least for those that are dealing with this as patients or individuals with these conditions. Hopefully you can at least maybe start to piece apart the why you got to a certain place and at least start formulating even if it's some small strategies like working on the gut or working on the emotional stress or chronic stress component. Those are also beneficial, even if we can't get somebody that understands the toxin exposure or, the autoimmune conditions, or there's other things to still work on while you continue the journey of finding somebody to help you appropriately. So hang in there. Thanks for hanging in there with these lecture series. And hopefully we'll have other good conversations in the future. Thanks so much.